Right-sided hypoglossal nerve injury, paralysis of right genioglottal muscle, tongue deviated to right side because of action of genioglossus on left side, is unopposed. Tongue deviated to right side, same side of lesion because of action of genioglossus on left side, opposite side is unopposed. Genioglossus muscle, one genioglossus muscle on either side, together they help in protruding the tongue outside. Action of genioglossus muscle, mnemonic, aim the tongue. A. Anterior, protrusion of tongue. I. Inferior, depression of tongue. M. Medial, push the tongue towards the midline. Protrusion of tongue, depression of tongue, push the tongue towards midline. It is also called as safety muscle of tongue, as it is preventing the muscle from falling backward into respiratory tube. Genioglossus muscle is called the safety muscle of the tongue. It helps in protrusion of the tongue, depression of the tongue, push the tongue towards the medial line. In deeply unconscious patient, genioglossus muscle is compromised and tongue may fall back into the respiratory tube. Therefore, in such cases, pull the tongue out to support the patient. Branches of cervical plexus. Cervical plexus is formed by C1, C2, C3, C4. At the midpoint of posterior border of sternocleidomastoid muscle, cervical plexus gives branches. Greater auricular nerve, C2, C3, supplies skin of greater part of auricle laterally and skin at angle of mandible. Lesser petrosal nerve, C2, supplies the skin behind the auricle. Transverse cervical nerve, C2, C3, supplies the neck region transversely. Supraclavicular nerve, C3, C4, supplies the supraclavicular area. Greater auricular nerve, C2, C3, lesser occipital nerve, C2, transverse cervical nerve, C2, C3, supraclavicular nerve, C3, C4. Cervical plexus is formed by C1, C2, C3, C4. At midpoint of posterior border of sternocleidomastoid, cervical plexus give branches. Greater auricular nerve supplies skin of greater part of auricle laterally and skin at angle of mandible. Lesser occipital nerve supplies the skin behind the auricle. Transverse cervical nerve supplies the neck region transversely. Supraclavicular nerve supplies supraclavicular area. All these branches are derived from anterior primary ramus of spinal nerves. Posterior primary rami of spinal cord supply a thin strip of skin on posterior aspect of head and neck region. To block the following branches, the block is made in posterior triangle or occipital triangle. Important information. Supraclavicular nerve has root value of C3, C4. Phrenic nerve has root value of C3, C4, C5. Therefore, any involvement of phrenic nerve in the abdominal region, there is a referred pain in tip of shoulder because of supraclavicular nerve root value C4. Left shoulder tip pain can be seen. Acute cholecystitis or splenic rupture. Supraclavicular nerve has root value of C3, C4. Phrenic nerve has root value of C3, C4, C5. Therefore, any involvement of phrenic nerve in abdominal region, there is referred pain in the tip of shoulder because of supraclavicular nerve root value C4. Left shoulder tip pain can be seen in acute cholecystitis or splenic rupture. C1 fibers carried by hypoglossal nerve supply genohyoid muscle and thyroid muscle. Ansa cervicalis. All other muscles in the neck are supplied by loop of nerve called ansa cervicalis. It supplies anterior neck muscle. Superior root of ansa cervicalis supplied by C1 fibers of spinal cord. Inferior root of ansa cervicalis supplied by C2, C3 fibers of spinal cord. In case of nerve 2 hypoglossal nerve, tongue muscle same side paralyzed.